going to move on now and introduce you to Kim. Kim is a professor. I'm avoiding the smart stuff on here, and I'm going to try and say what Kim does, which I think what Kim does in an academic world is look at ways that people can be included in finding ways to ensure that a range of people with learning disabilities, families, professionals and others, can be involved in improving the way we do things, the practice, the way we support people. Is that fair enough?
Absolutely perfect.
Good, thank you. Phew. Because, yeah, okay, wonderful. Over to Kim, thank you.
Thank you.
You're mic'd up, aren't you? Yeah, okay.
Yes.
Do a sound check.
Thank you very much, Sally and Andrew. I wish I could have thought about that description before, actually. It's really straightforward and precise. And I'm really honoured to be here today. I feel a bit of a fraud, actually. I'm a passionate nurse. I come from a nursing background, but I have no expertise in caring for people with learning disabilities. So I feel a bit of a fraud, but what I do bring is insights into how to work together, how to be person-centred, how to change the culture, so to really position our values. And so I do want to honour where this community of practice has come from. And when I started in my new job in about 2012, I was a joint appointment between the university and East Kent hospitals, and I was then asked to go to one of the faculty team meetings in the university to see how we could work together, practice development and faculty. And I met up 4 people at that faculty, and they were all going to be here today, I hope. So one of them is Cathy Bernal, Cathy here, Cathy Bernal, Andy Nazuka, and Andrew Southgate, I don't think is here. And at the same time, I met Daniel Marsden, who was in the other part of my post in terms of learning disabilities, and it was really that connection with those passionate people who enabled the first community of practice for people with learning disabilities and those caring for them to actually happen in Canterbury. And since then, we've worked really closely with our colleagues, George at HEX and Rona at West, as well as England's Centre of Practice Development, and they launched an equally fantastic conference last year, and now we're in this massive social movement, which is so great to see how many people there are here today, and also from the saying, you know, from acorns, oak trees grow. So that's brilliant testament, and let's hope it's the beginning of a real massive social movement that can sustain this activity over forthcoming years. So I'm honoured to be here. I am not a robot, by the way, with all this stuff on me. I am Kim, and what I'm going to do is possibly ask some questions that will help you think about how you take forward the community of practice and what is important. So where I share some common ground with all of you is a focus on growing people, whether those are the people that we serve and care for, or whether those are the people that we work with. I'm passionate about that, and I share those values that you hold. So I'm hoping that the sorts of questions that I ask, you will think about. I realise we've got a very varied audience today, and what I say may not link into everybody here, but I'm hoping that everybody will be able to take something away from my presentation. Good. So to start off with, I believe in helping people to flourish and grow, and that's why that tree is in the background there. But what I hope to achieve is to look at just making sure we're really clear about what a community of practice is, what are our aims and values, how do we go about achieving our values, because we talk about them all of the time, and talking about them does not mean that they happen. What is person-centeredness? What do we mean by that? How can practice development as a process help guide your direction? And what are the strategies for increasing equity of access? Because you know, in the title, I was focusing on how we continue to build the community of practice and particularly look at person-centeredness and equity of access for people with learning disabilities. And then I want to share with you some insights from working with another community of practice for health visitors, which was a formal research project supported by HEX, and what insights there may be to be aware of to think about your future. So I'm hoping that's going to be right. Okay, so to start off with then, community of practice. We're using this word glibly. Are we making sure that we're using it in the way that we intend it to be used? So, you know, communities of practice are groups of people who share a concern and a set of problems or are passionate about a topic. And there's no doubt that everybody here is passionate about the care, the health care that's experienced for people with learning disabilities. And also the community of practice is about deepening the knowledge and expertise in this area and interacting. So as Andrew said, you know, it's about getting to know each other. We need to get to know each other. We're working together. Everything can happen in our relationships. And through our relationships, we can be very powerful. So it's a group of people with a common interest. It's a group of people with a common goal of improving. And it's a group of people who share experiences. So I think we can tick all those boxes so far. So what is the aim of the community of practice? Well, our aim that's been agreed, that's guiding this work, is to work towards the eradication of health inequality so that everybody can access a quality service by supporting our carers, our care workers and all professionals to be person-centred. So that means a focus on the person. Being person-centred is not just being respectful and compassionate. It's also about enabling people to make the right choices that are right for them. And that means we need to know the person that we care for and know the people that we work with to be able to do that in a good way. The second thing is about providing best quality of care and support. Well, for me, quality of care is person-centred. It's experienced as person-centred. It's also safe and it's also effective, which means that we're using the best research and the best evidence available to inform our care. And then thirdly, it's about improving equality and access. So the focus is on the staff and the system, education, policy and research. All of these things will help us to improve access for people. So, shared purpose. I've talked about what your shared purpose is. Our shared purpose defines why we are here. Why are we here? What is it we're trying to achieve? And the shared purpose results from a group of individuals who align their values and beliefs with a common challenge, a common vision and a common goal. However, having a purpose, having a set of values are only the first part of the journey. We also need to commit to each other what it is we're going to do when we work together and the standards by which we are going to work. And our values and our purpose need to guide that. So I would say to the community of practice, we've got purpose, we've got values. Have we got commitments in terms of how we're going to work together? Have we got standards in terms of what we believe is best practice? So those are just questions to think about. So the core values underpinning the community of practice, being person-centred, providing best quality care and support, improving equality of access. Are those all the values that you sign up to? Is that all the values that everybody signs up to in this room? Yeah? Am I hearing a loud yes? Yes. Good. Excellent. And so this diagram will tell us where are we in getting those values embedded. So we think we got some agreed values, so at the bottom of that arrow. Are we talking about what these values mean? What does person-centred mean? What does equality of access mean? Is that where we're at in our journey? Are we actually supporting and challenging each other to live the values? So when you come across a person who's not person-centred, who doesn't treat you as a person, are we able to challenge that when we observe it or when we experience it? Are we at that stage in our development, or is that an area we need to focus on? And lastly, how are we embedding all our values into the way we learn, what we consider is important to evaluate, and all our governance systems? That's where we need to get to for the community of practice as well as for healthcare. So the parallels are there. So questions. It's good to ask questions. I'm doing a project that looks at safety culture, and when I go into these areas that look at safety culture, what I'm looking for is where are the most vulnerable people and the most junior people and the most inexperienced people? Are they enabled to ask questions? Because that tells me that we've got a really good, safe culture, because people feel they can ask questions, however trivial or however insignificant they might be. So what does being person-centred, best quality of equality of access look like? And how do you know you are achieving this? So these are questions that the community of practice need to be really confident in being able to answer. So I've taken a well-known definition. It is a bit of an academic definition, so I've emphasised the things in red that are important. So what is person-centredness? And I can spout this definition, but it doesn't make any difference to how we work together unless we've talked about what person-centredness means. So it is an approach to practice established through the formation and fostering of healthful relationships that I've talked about, where we respect each other and get to know each other between all carers, service users and other people important. It's underpinned by values of respect for the person. It's about the individual's right to self-determination, mutual respect and understanding. And it is enabled by cultures of empowerment, where people feel empowered to ask the questions. And it's also enabled by continuous development. We will never ever get there. There will always be things to respond to, act on, be proactive about. So person-centred cultures enable everyone to flourish. And I use this photograph frequently because this is very high up in the Apennines in Italy, and it's under a canopy of trees. It's very difficult for the light to get through, but what you've got is this lovely growth of wild garlic that is flourishing, and it's flourishing because the conditions are right. And we know how to get the conditions right, and if we get the right ingredients, we can all flourish, even in these days of austerity. So what is the purpose of practice development? Practice development, which is the area I work in with all disciplines, is about developing effective workplaces that are person-centred. That means they're good places to work, and patients and service users are at the heart of what we do. And staff experience these good places to work. So it's good for staff and it's good for the people we're working with. And this is the very simplest model of practice development, and I've included it here because of the importance of having those shared values and vision. And how do we enable person-centred care to be established? We do that by building on our shared values and vision. We also look at how we transform the context in which we work, the workplaces and the individuals we work with. And we do that through helping people to actively learn. So learning for me is not going into listening to people like me, tell you things. Learning is about helping the person to look at their own practice and say, what is it that I understand about how I practice and how I learn, and how can I do things differently, and how can I be more aware of the consequences of my actions on other people. And it's also about this authentic engagement, which is just about building genuine relationships. So practice development has a lot in common with people who have learning disabilities and how we support and work together. And the journey in practice development always starts off with knowing and demonstrating values and beliefs, developing a shared vision, so again tick tick for those first two stages for the learning, and then measuring where we are starting from. And this is where some of the challenges for the community of practice will be. How do we know where we're starting from? What are the important measures that can help us with that? And which ones do we focus on? And as we go through our journey, which is never a circle, because of our learning, we never come back to the same place again. We always move forward. But what we're trying to do is achieve this vision of a person-centred culture, person-centred care. So, some of the things that we know we need to do is to be collaborative, to be inclusive, to be participative, to enable all of our stakeholders to work together. We need cultures of empowerment, that people can ask questions and challenge even the most powerful of people. We need the values of respect for persons, individual rights to self-determination, mutual respect and understanding. So moving now, so the challenge is, what does person-centred mean to you? That's the challenge I'm offering you. Moving on to the second value, which is equality of access. Now I've drawn on an esteemed colleague, Ruth Northway. Well, she would be a professor in people with learning disabilities and their care in Wales now. Daniel, that's right, isn't it? She's in Wales. So I've drawn on her work. This is not my work, but if you understand again, what does equality of access means? It means that all people have the information they need, regardless of their age, education, ethnicity, language, income, physical limitations, or geographical barriers. And it also means that people are free to exercise their right. So for me, that's also being part of person-centred, being person-centred. And so Ruth Northway, she identified 4 domains that we can all work on in the community of practice to ensure that equity of access becomes a reality. The first one she identifies are practice, the practice of healthcare. And she said there's so many barriers out there. So is the community of practice, is it actually quantifying what those barriers are to people with learning disabilities? What are the specific health needs that people with learning disabilities have? Are we collating that information in a way that can be used politically? And how are we going to eliminate negative and discriminatory attitudes? What are the ways, what are the strategies that work? So for the questions I would be asking are on the right. So how can the community of practice help people to overcome the barriers? What strategies work? How can we help people use them? What are the most commonly experienced health care needs? So moving on to the second domain, which is about education. Now, I know that you've got brilliant models in learning disability. You know, people with learning disability are engaged in education. They're co-facilitating, co-chairing, which is absolutely brilliant. But how can a community of practice enable all this involvement to happen on every level, and what stories of impact do you have? So the importance of growing stories of impact which show how working together makes a difference is really, really important. The third area is policy. How do we help to change the policy? How do we together as a community of practice help to change policies informed by raising awareness of the things that impact on policy? How does the community of practice influence policy? And then lastly, the domain is around research, and I think this is where you have potential for growth and development, because there's a great danger that we just measure everything with this good baseline data. We can measure how many people go into hospital with learning disabilities. We can measure how many people are accessing services. But it's no point just measuring everything. We've got to decide what are the most important things to measure. So we don't just measure everything. We decide what is it that's most important and then decide to measure that. So how do we enable everyone to contribute to data collection? So Daniel, for example, has done an action research study where he has involved everybody in the action research, and we need to be doing much more of that. So in terms of collecting the data to answer the questions that we want to ask, and keeping a focus on the whole, not the part. Because if we just focus on the part, the single measures, we will lose out the quality of learning about the whole. So those are the sorts of questions and challenges to alert you to. So where are we in terms of embedding our purpose and values? And I don't know where you think we are, but for this community of practice, I suspect we might be between the second and the third areas, and we need to also think about how we're going to embed our values into those measurement systems, and how the community of practice can use what we can measure together as a massive community to change and challenge policy. So embedding our shared values is where we want to be. How do we do that? I've used this nice picture of Canterbury Cathedral cloisters because it conveys structures, and our structures need to be informed by our values. So we do need to work together, involve and enable participation by all. We do need to be able to give and receive feedback to each other at every level. We do need to provide high support and high challenge to each other, because we know that combination is absolutely the right combination for effectiveness. So one challenge I would give to you today is to ask a colleague or a friend or a care provider, how challenged and how supportive have I been to you? And get a score on 0 to 10, all right? And what you're aiming for is high challenge and high support, because that is the combination we have to get right in our relationships, and that's going to be different for everybody. We need to create an open, direct culture that listens and acts on feedback. We need to evaluate progress together to enable our shared decision-making and learning to be implemented. We need to celebrate, and we don't do enough celebration. Celebration, where we started off with a brilliant celebration, that set the tone for the day. It gets all those endorphins coming out, you know, and making you feel really good. And we need to do much more of that to change our mindset, our emotions, so we focus on what can be achieved rather than what can't be achieved. And we need the systems in place to support and challenge you, whether you are a person with learning disabilities or whether you are a caregiver in the system. We need those in place. So coming towards the end now, I just wanted to share with you some of the journeys that the community of practice of health visiting went through. This was a formal research study, and we worked hard over a year with health visitors. And they started a number of journeys, seven of them here. So at the beginning, they were getting to know each other and networking. This is really important for us here. At the end, they were working together, supporting and rejuvenating each other in a shared passion for health visiting. So we're on that journey now. The second journey was they weren't clear about what a community of practice was. What is this thing, a community of practice? By the end, they were developing health visitor practice together and sustaining that community of practice and influencing national policy. The third journey was learning about themselves. By the end, they were becoming confident and empowered to challenge and to question. At the beginning of their journey, they were clarifying, analysing, questioning, valuing the role and practice. At the end, they were able to really articulate politically why it was so important that health visiting had a role that would impact on healthcare for people from 0 to 3. The last 3 journeys were learning to use tools as a participant and then using tools with each other, developing reflection and enabling skills together, and becoming more reflective and enabling others to be reflective. And lastly, to develop some of the theoretical insights that make clear why we do things and why they have a positive outcome, to actually developing their own theory about their own practice. What we discovered with the community of practice, we were there to help them develop their practice as health visitors, but they were all working in toxic teams. toxic teams, and they were using these tools that are available to us in everyday practice to begin to challenge those toxic teams. So this was one of the collages that the health visitors shared about the sorts of toxic teams. It was like a war zone out there, and how those teams could be supported over time to enable them to change the culture so that it's person-centred, it's delivering the health outcomes, it's enabling equity of access. So, in conclusion then, the thing I'd like you to take away with is this concept of culture, the workplace. Now, I use the culture just to describe the way things are done around here, whether that's in the community of practice, whether it's in your own relationships, your own support networks, whether it's in community, hospital settings or wherever. The culture we have to attend to. All of those things I've talked about will help you. Those simple getting feedback, giving feedback, enabling questions, giving support, giving time, will help change the culture of your relationships and the broader culture. If we don't attend to culture, we do that at our peril, because culture will eat strategy for breakfast, lunch and dinner, which means that however good your intentions, however laudable the values, unless we attend to culture, we will not be able to make that tree, that acorn, grow into a forest of trees. So I want to leave you with that. I would like to say that what are the next priorities in helping the community of practice to flourish? I'm hoping that I've asked some questions that will help you to reflect and to think on what those are, because I know we're also doing some important work together later on, looking at how we take it forward. I'm going to leave you with this lovely flourishing picture, again in Italy, with lovely vibrant flowers, different colour flowers. Everybody can flourish, and that's what we've got to keep in our mind to try and achieve. So thank you so much for listening. I've got some contact details there. I'm happy to talk with anybody further about anything I've talked about, or any way you think I might be able to work with you, support you in your endeavours. Thank you.
Thank you very much.